Hey, well, we'll go ahead and get started. Good morning. Welcome everyone to the Swetland Seminar Series. My name is Linnea Webb. I'm a project manager here at the Swetland Center for Environmental Health, which is in the School of Medicine at Case Western Reserve University. And if this is your first time here at the Swetland Seminar, typically we do the Swetland Seminar monthly. Sometimes skip a few months throughout the summer. So we'll be skipping October, but we'll have another one in November on the 18th. And if you haven't already, feel free to put your name and organization in the chat box to introduce yourself. We always like to see where people are joining from. So thank you all for being here today. If you're not familiar with the Swetland Center, in the late 1950s, David W. Swetland and Mary Ann Swetland felt not enough was understood about the unintended health consequences of chemical, agricultural, and industrial products in our environment. So they focused the Mary Ann Swetland Professorship of Environmental Health Sciences on preventative medicine and the threats of man-made environmental hazards, so that all graduating doctors would have an interest in and understanding of the impact of the environment on human health. So for over 30 years, the Swetland Center for Environmental Health has cultivated partnerships to develop and expand solutions that enhance environmental health for everyone. And our work encompasses various exposures influencing health outcomes throughout life, such as asthma, chronic diseases, mental health, and infant vitality. And we're recognized for our collaborative and adaptive approach that transcends boundaries to foster healthy environments where people thrive. Our mission is to accelerate pathways to vibrant and healthy communities through collaborative research, immersive training, and authentic community engagement. The Swetland Center has a three-pronged approach focused on research, training, and education, and community engagement. And our goal is to build capacity for the next generation of scientists to work alongside community partners to promote healthy environments for people to thrive. If you're interested in learning more about the Swetland Center, I will put this link in the chat for our website, case.edu/Swetland, as well as our email, swetlandcenter@case.edu. And these are our values: innovation, respect, collaboration, and participation. Our next Swetland seminar, as I mentioned, is in November. So Tuesday, November 18th from 9 to 10 a.m. It will also be on Zoom. I'll put this link to register in the chat. Dr. Jared Liddy is going to be presenting sociodemographic composition and barriers to advancements in water treatment in U.S. community water systems. So he's going to discuss geospatial approaches to estimate the socio-demographic composition of over 44,000 community water systems service area boundaries nationwide. Dr. Liddy will also share about an ongoing study to investigate socio-demographic disparities in the adoption of advancements to water treatment processes among CWS nationwide and improvements to the harmonization and accessibility of U.S. drinking water data for researchers and the public. So I'll put that link in the chat if you'd like to register. And that will be our final seminar for 2025. So you can also subscribe to our newsletter, the Swetland Scoop, for the schedule for 2026. So share all those links in the chat. And then I'm going to turn it over to Dr. Darcy Friedman, the Swetland Center's director, to introduce today's speaker.
Good morning, everybody, and thank you, Linnea. It's great to be here. It's been a minute since we've had a seminar, so it's nice to have everybody together again, especially with our presenter today, with one of our former postdoctoral scholars, Dr. Eun Kyung Lee. So I'm going to give a brief introduction, and then we'll get started. So Dr. Eun Kyung Lee is an assistant professor of environmental health and environmental justice at SUNY College of Environmental Science and Forestry. Dr. Lee is a recent recipient of a pilot project award from the New York University Collaborative Center and Children's Environmental Health Research and Translation, which supports the work to be presented today. She received her PhD in Environmental Health Sciences from SUNY University at Albany and her Master of Public Health from Tufts University School of Medicine. Dr. Lee's recent research has focused on investigating how racialized housing policies have shaped neighborhood, social, and built environments, how these environments influence exposure to environmental and climate-related hazards, and how they continue to contribute to disparities in chronic diseases, particularly among racial and ethnic minorities and low-income communities. She leverages complex, large-scale spatial, environmental, and health data to identify and inform geographic areas with the greatest need for targeted interventions. So with that, turn it over to Dr. Lee to begin her presentation.
Great. Good morning. Can you all see my slides, the presentation mode?
Yes.
Okay, great. Thank you. Thank you so much for having me.
The slides are in the notes mode, right?
Notes mode. Okay. Sorry about that.
That's okay.
Stop sharing and reshare again. I need to try that again. Let's see. Still.
Yeah, that's still in the notes mode.
Okay, great. Wow.
There we go.
Okay, great. Well, thank you so much for having me, and Darcy for Swetland Center for inviting me to the presentation. It's always great to be back, even if remotely, and be able to present this work. And yeah, for those, just as Darcy mentioned, for those who don't know me, I was a postdoc at the Swetland Center about 3 to 4 years ago. And just really as a brief background, when I joined Swetland Center about in 2020, COVID hit right after I joined, and that was really a time for me to really engage at the Swetland Center and really get connected to the staff and trainees at the Swetland Center, but also a time to be able to really discuss these issues, health disparities issues, and the struggles that the community members as well as the community partners that we are working with in Cleveland we're having, which partly motivated the work that of diving deeper into redlining and the ongoing impacts. Fast forward to today, for the past couple of years, I've been continuing this work as a faculty member here at ESF, and I'm sharing some pictures of. I think I am covering those pictures, but on the slides, I'm sharing some pictures of the campus where we are, really specialized institutions in environmental science, engineering, and natural resources, and putting that into action on campus as well as research. And where I have been continuing this work of looking at redlining and, environmental and climate issues as well as health outcomes here at ESF. And so. And so before I begin with the presentation, and just as I take an opportunity to acknowledge the land that we are here, in acknowledging the Onondaga Nation, the indigenous people on whose lands, whose ancestral lands SUNY ESF stands. I'm also taking this opportunity to share, a glimpse of the beautiful natural landscape of Central New York for those who haven't had the opportunity to visit. This is Onondaga Lake. It's really nearby Syracuse city, and a lot of, just to highlight a lot of the work that's being done by SUNY ESF faculty here on Onondaga Lake. Although it's really beautiful, it's also considered as one of the Superfund sites. So a lot of the work has been done there, as well as areas, the neighboring environments. And one of the surprises that struck me when I first joined ESF was that also Dr. Robin Kimmer is also a faculty member here at ESF. And I think we had a reading at Swetland Center a long time ago about braiding sweetgrass. And so there is a lot of research going on here that's related to, environment and how we connect that to the society and human health. And so that was just a glimpse of my introduction and where I am conducting research myself. And so just as an icebreaker and just to kind of move on to the mode of, of today's talk, which is more of extreme heat. I wanted to start with, posing the question, this simple question about your experience with extreme heat. During this past week or past summer, have you experienced extreme heat yourself? And maybe just with a, raise in hand with using the icon, you can. And I see all hands. And I think this is kind of an obvious question by now. And I'm assuming that everyone raised hand. And so extreme heat affects everybody. And I'm going to pose the second question. So we all experience extreme heat, but how would you define extreme heat? How would you define extreme heat? And maybe you can reflect on your own or respond to the chat or unmute. But I think it's important to understand how we define extreme heat. And I'm going to start this seminar by defining what extreme heat is defined as. And there are different ways that researchers have defined extreme heat. And one of the most common ones are extreme heat, a period of abnormally high temperatures of 90 degrees or higher, or if you're in Celsius, 32 degrees or higher. And also a lot of researchers have defined as heat waves. So 2 or more days of 90 degrees or higher, or based on the distribution of the temperature, the high is the top 1 or 5 percentile. And most recently, and although this is not a new concept, land surface temperatures have been also used to define heat with issues with urban heat island effects. And I think many of you in the audience might know what urban heat island effects are, but it's just a phenomenon where mostly happening in the cities where there is an accumulation or higher temperatures because of the built environment that is designed in urban areas with buildings and the landscape trapping heat in the center of urban areas. And land surface temperatures tend to be higher than air temperatures. And this has been used as proxy for urban heat island effects that are measured either directly, so measuring directly, the surface of the temperature, but also being measured more of the satellite imageries that can be, that are more of, images that are taken from the satellite based on color wavelength and kind of examining the temperature wavelength. And so these are the most common ways that extreme heat can be defined as. And historically, there has been major, documented heat events, and many of you have heard of, the case of Chicago, where there has been about 750 deaths in the 1990s that lasted 5 days. And there has been, historical and significant major events in Europe as well. And as you can see, these heat waves or heat days have been longer, leading to increase in deaths. And as you can see, the longer you're exposed to, the more deaths for obvious reasons. And you can see different studies that's been conducted in different areas where there has been increase of mortality rates due to exposure to heat waves or extreme heats. And you are seeing the news that there are more cases of deaths related to heat or across the globe, and these are continuing to increase. So this is no secret, and so we are continuing to have the threats of heat and health impacts associated with its exposure. Within the US, and these are the numbers from the EPA, heat waves are becoming more frequent. When we used to have, one perhaps heat wave during the summer, we are having more heat waves and more frequency of extreme heat days. They are becoming longer. When we used to have 2 days of extreme heat days, they are becoming 3. And they're becoming more intense. So we are having, the degrees are becoming higher. And I'm just putting as an example New York State, within the US and within each state, there are also variations across cities. So as you can see here on the right, New York City is having more number of heat days, but also extreme heat days, but also these are expected to increase. And you can see that the more urban, there are more extreme heat days. And this illuminates the importance of understanding urban heat island as well as extreme heat days together. It is also no news that among all natural disasters, heat-related deaths or heat-related impacts are among the top. And it continues to be the leading cause of summertime mortality as well as mortality, morbidity. You can see on the graph, it's increasing over the years. And this recent paper that was published in JAMA, the numbers on the right, you can see that heat-related mortality is continuing to increase. So if you pay attention to just for the last 3 years, 2000 to 2003, you can see that it's 1,000 to 2,000 has doubled for the past 3 years. So these are becoming intense, and the health impacts are becoming more and more. A paper from Mora and colleagues in 2017, they published this, projected heat-related risk for the end of the century. And this was done in 2017, and they already projected that by the end of the century, there will be half or 40 or 50% of increase in heat-related mortality, even under drastic reduction scenario. So even if we made significant efforts to reduce greenhouse gas emissions, these are expected to increase. So there needs to be really a significant effort to decrease greenhouse gas emissions and overall heat-related or climate-related impacts. And so we know that there are health impacts associated with heat exposure, but there are some physiological effects that are stemming specifically from heat. And these are more likely to, a lot of circulation related issues. So blood vessel dilating, but also the ability of releasing heat that affects differently for, adults compared to children, and more related to, asthma. Heat narrows down the airways, making it harder to breathe. Drier air or humidity affects the airways, so that can also trigger asthma. And also just dehydration from warmer temperatures can imbalance and worsen asthma symptoms. There are other factors built as well as social factors that may worsen these impacts. And as I mentioned in the beginning, urban heat island effects due to trapping of heat in urban areas that can be led by less green space and tree canopy, as well as that leading to warmer temperatures and increasing air pollution, as well as air pollens. And also many of you have evidenced wildfires in California and Canada as well, that increasing the risk of wildfires triggering asthma. There are other factors that are related to social factors such as that are also as significant asthma triggers, like housing quality with different asthma triggers, or ventilation. Not everybody have access to cooling system, inside the house, but also ability to travel to access cooling centers. And also, even if they have access, perhaps they are living in unsafe neighborhoods, making them unable to be outside. That all leads to adverse health outcomes. And many of you have seen this, read this paper from Hoffman that this disparities with, that follow neighborhood disparities are also evidenced across neighborhoods. And this has been, there has been several studies now that quantifies, urban heat island effects across different neighborhoods. In this paper from Hoffman and colleagues, they quantify, land surface temperatures in areas that have been historically redlined versus not redlined, and they estimated that redlined neighborhoods had 3 to 7 degrees higher compared to not redlined neighborhoods. And there has been other studies that examine or have validated this disparities in temperature across different U.S. cities. And across different U.S. cities, there are disparities, there are differences in the degree of the disparities. So to complicate this a little bit more, within those cities, within those, cities or neighborhoods, there are also, it's not only one kind of communities, but there are disparities within those, or there are different subgroups of population that live within the cities that can have different impacts. So the last paper from Sue and colleagues, they estimated that within those U.S. cities where they estimated the land surface temperature, Black residents overall experienced 0.5 degrees Celsius warmer than the average for their cities, and for the white residents, they estimated the opposite. And this pattern was similar to wealth, socioeconomic status. And so, although we are seeing disparities across, comparing different neighborhoods, within those neighborhoods, there are also disparities among the residents that reside among those neighborhoods. And yeah, to highlight this, and this paper from Jesta and colleagues also was published in 2013, and they also estimated or characterized the subpopulation that were at a greater risk of residing in heat-prone areas. And they estimated, the way they did this was to examine, neighborhoods where there were no tree canopy, as well as impervious surface areas. And based on those both metrics, they found that Asian population, more than 50% of Asian population lived in heat risk areas. About half or 50% Hispanic lived in heat prone areas, as well as 30% in heat prone areas. So within the same neighborhoods, there are disparities of how different racial groups are experiencing heat as well. And so I guess that's kind of why I wanted to dissect deeper, not only looking at redlining neighborhoods, but also how there are disparities across different racial groups. And the focus of the work that I am going to present is for all New York State. And for those, I don't know if any of the audience is from New York State, but New York State is a big state, just like Ohio. But you can see on the left side, it's a pretty big state in comparison to other states. And for those who are, just for just reading literature, you can see that a lot of the studies are focusing on in New York City. But if you see the map alone, New York City is really a tiny portion. Of course, population is it's highly populous city, but there are in New York City, New York State, there are limited studies that examines not only urban heat effects, but also other environmental issues. There has been independent reports of disseminating disparities issues, but there hasn't been really studies that have focused to understand its impacts across all New York State. And this also becomes crucial because, as I mentioned, there are racial disparities, but also socioeconomic status and socioeconomic issues are also might be contributing that have been underestimated, and that needs to continue to be being addressed. And just to highlight, this New York State has one of the top cities with the highest Black and Hispanic concentration of poverty. And I think children it's one of that cities with the highest rate of poverty among children. And just for your reference, Cleveland is what I'm highlighting here in blue. And so this really highlights the need for continued research and focus on in geographic locations where there are other significant factors like poverty as well as race contributing to disparities in health disparities. And to just dive more deeper into underscoring the needs is that there are not only environmental and other racial issues, but also social issues, more need for other issues that are arising as there are ongoing developments. So just to illustrate an example, there is ongoing development or demolition of a highway here in Syracuse, I-81, and that is highlighted in blue. And this really cross path towards Redlining neighborhoods, where you can see that the background is land surface temperature. So in the middle, it's high temperatures, land surface temperature being higher towards the middle. And there is an overlapping of, land use or, highway being demolished, as well as Superfund Lake. And these communities are being asked to, move away from these places. So there is a lot of accumulation of issues that are undergoing. And so while there is a need, I think it's also important to consider that there are other urgent needs that we need to take into consideration while we are conducting or trying to understand heat related or any environmental related issues. And it's really I think it's really hard to silo this as one problem, but a multiple systems problem. And I'm just as I've been trained by Dr. Friedman, I think we always have to think in systems thinking, where there is no only one problem, but also problems that are more cascading effects that are affecting health outcomes. So if you just look at redlining, how that affects built environment, and that how that influences temperature as well as urban heat island effects, and how that influences air quality and therefore asthma. But there are other crises that are happening throughout the time, like COVID, that can also influence the level of air quality as well as temperature, or increase the quality of air quality as well as temperature with, things like high demolition or wildfires. So I think it's important, although complicated, I think it's important to consider all these factors that play a role in contributing to disparities in asthma. And so what we already know, and I think some of the trainees here are on the call, but back in 2020, the trainees here at the Swetland Center, we conducted a systematic review looking at the impact of redlining alone on health impacts. And on this systematic review, we found that there are some adverse health impacts, including asthma and heat-related diseases from exposure to redlining alone. Although very limited back then in the understanding of these relationships. And these two studies found that there are increased risk of living in redline neighborhoods. So you can see higher risk for B compared to A-graded areas, C versus A-graded areas and D, as well as heat-related impacts, so increase in relationship with redlining and heat. There are, on the other hand, significant health impacts related to extreme heat. So looking at extreme heat, so exposure to, abnormally high temperatures and how that has an impact on mortality or, other health outcomes. And these are really great studies that gives us an understanding of the risk related to extreme heat. But most of the studies are limited on how they measure extreme heat. So a lot of the data that comes from measuring temperature are coming from monitor stations. Some of them are from satellite. Some of them are at the zip code level, county level. So the geographic coverage is limited, and what we are exposed to here versus 2 miles away is drastically different. And so I think that is, I guess, one of the rationales why land surface temperature was used for this study, because of the geographic coverage, as well as providing us more insights of more of neighborhood environments and how can we change the urban landscape to inform policy decision making and prevent exposure to extreme heat in the first place, rather than understanding the risks after the fact. So for this study, we examine the impact of redlining and how that influences disparities in urban heat by measuring by redlining, and how that influences disparities in asthma, and then looking at disparities by race and ethnicity. And so for methods for this study, as I said, we focus on in the entire New York State. And this study focused primarily on children who lived in cities that have been historically redlined by homeowners loan corporation for the summer months. So we only focused on June, July, and August for 5 years, 2018 to 2022. And this was based on 13 cities across all New York State, including upstate, Central New York, and New York City. And for New York City, we included different areas. So within New York City, there are 5 boroughs, but for the analysis, we counted them as one cities because of their proximity and heterogeneity or homogeneity. And so including New York City as one city, there are 13 cities that we included for the analysis. And for the outcome, we examined, children who had at least one asthma-related ED and outpatient visit between those 5 years. And so for the outcome, it was ED visits and outpatient visits, and this was based on hospital data. New York State collects data for all New York State Department of Health collects data for our New York State, and this is a mandate from New York State, and so 95% of hospitals have reported to New York State Department of Health, and that is where we are getting this information from, based on ICD codes. And for the exposure, there were two exposure metrics. So one looking at redlining alone, and the other one, urban heat island based on land surface temperature. And this was defined as high versus low, median values for each census tract for each month and for each year. And this was derived from satellite imagery data. And for imagery data that we didn't have clear images, so there's like a lot of issues with cloud coverage. We obtained those from Google Earth engine with a spatial resolution of 30 to 30. And we kind of averaged those to census tracts. And so by overlaying, exposure to ED visits and outpatient visits, we linked that to census tracts based on children's residential addresses. And then we conducted analysis based on those linkages. So based on that data, we conducted Poisson, and we adjusted for potential confounders, individual level data confounders, as well as other neighborhood factors that are known to be associated with heat or redlining related outcomes. And this includes, poverty level, smoking prevalence, housing, transportation, other environmental factors, as well as the number of cooling centers within the census tracts, as well as green space. And so we examine those impacts independently, as well as interactive effects, and stratify that by race and ethnicity. And this was kind of, and I know this can be a little complicated, but the way that we kind of analyzed was looking at independent impacts of redlining and also together redlining and high urban heat island effects. And our hypothesis, it was that those who are residing both in C or D graded areas as well as high urban heat areas would have increased asthma related and outpatient visits. And I kind of wanted to highlight the interactive effects as well, and the reason why it's important that we kind of did the additive and the multiplicative interaction effects is that there might be other factors that might be having amplifying effects that can be demonstrated with interactions. And so just to illustrate the additive effects, you have 2 plus 3, you have 5, 2 plus 5, 10, you have 12, but then you multiply them, you have additive effects. And there might be multiple reasons that could explain those multiplicative effects. So those are the analysis we conducted and some preliminary results from those. And these are kind of preliminary, and I think it needs some more thoughts and reflection towards the results. But I'm always welcome to I'm always welcome to any thoughts or suggestions based on the results. But just by going through exposure first, for urban or land surface temperatures by whole grades, we found overall, for all periods, we found that there was a slight higher land surface mean temperature in D graded areas in C compared to A or B graded areas. These were a little different pre-pandemic and during pandemic. And for those who are better with seeing the actual numbers, you can see that during the pandemic, land surface temperatures decreased, and this is consistent with the literature where there have been not only decrease in air pollution, but also temperature as a consequence of perhaps less human activity. But within those areas, you can see that there are the differences from D and C compared to A. There were on average 1.5 to 3.2 degrees of difference. For more visualization, these are the actual land surface temperatures across different cities, and it's hard to see the actual numbers, but or the letters, but you can guess that the areas that are in blue or higher land surface temperatures, they were typically A graded versus those that were degraded or had higher land surface temperatures, and those are typically in downtown areas, and you can see also just looking at Manhattan here, you can see that a slight glimpse of blue areas because of the water bodies that you can see that may influence the land surface temperature. So this is just to illustrate kind of how the distribution of land surface temperatures are across the neighborhoods. And for demographics, and I'm just going to go really quick through the next 3 slides, and just to highlight the disparities in among the racial groups, among the general population. We found significant also disparities or changes in demographics across New York State. And just to pinpoint one as an example, here in Rochester, you can see in degraded areas, the white parts are white population, black population, and orange color is Hispanic population. You can see in Rochester there was higher proportion of Black population in Rochester versus air-graded areas. And same thing for other cities. But this trend or demographic trend changes across New York State. And so I think, and same thing for the income changes disparities. And for the sake of time, I think I was unaware of time, but I'm just gonna go through this, the study population. Within the study population for asthma-related emergency healthcare visits, across all whole graded areas, there were more patients in degraded areas, and as you can as hypothesized, there were obviously more increase in among Black and Hispanic populations with worsening grades, and decrease among white children in this case. And for health insurance coverage, there wasn't much difference across different whole grades, with most children being covered by private insurance compared to Medicaid insurance. So jumping into the results, and I'm going to go really quickly. Just looking at redlining itself, we didn't find significant health risk associated with redlining, but we saw a slight increase in C-graded areas across all study period, particularly during the pandemic. You can see there is a slight increase. And there are many reasons that this the results, there are many reasons that we are finding these results in C-graded areas. But one of there has been an increased literature where there has been more areas with they are now seeing a lot of adverse effects in C-graded areas versus red line neighborhoods. And there has been a lot of changes in demographics that might be influencing this shift and disease trends. Looking at urban heat island or urban heat exposure itself, I know this is a little bit complex to see, but overall, you can overall for ED visits, there has been an increased risk of ED visits. You can see that there is a kind of a U shape for ED visits. So the first column is like all graded areas, A, and the second is AB. The third is C, and then the fourth is D. You can see that in highest risk in AB and degraded areas, but overall, highest risk from urban heat exposure alone. And for outpatient, there was a decrease in health outcomes related to urban heat island effects. When we are looking at the joint effects, there was a shift in the findings, but overall, I think there was a clear clear increase in risk when you're exposed from co-exposure to high heat areas as well as C and degraded areas. And we are still thinking over this, kind of trying to interpret the right way. But some of the rationale for this high increased risk is, that there might be during the pandemic more exposure to other, asthma triggers, people being confined indoors, having greater exposure to heat as well as asthma triggers, less access to air conditioning in unsafe neighborhoods. And although the main effects were a little, there wasn't much consistency across the results. There are clear consistency across when we stratify by race and ethnicity, where overall for all analysis, it was overall highest rates for Black, Hispanic, as well as Asian children for outpatient visits. And I'm just going to go really quickly because the findings are similar for all analysis. And so just overall, we found that redlining alone, there was a slight increase among those people or children living in segregated areas compared to other areas. And this was particularly true during the pandemic. For urban heat island effects, we found significant increase overall for all neighborhoods. So regardless of neighborhood residents, there was an overall increase. But from co-exposure, there was significant, co-exposure effects from living in segregated and degraded, as well as high urban heat island effects. And we found significant, disproportionate impacts among, Black, Hispanic, and Asian children. And so I think there is based on these findings, there are some more reflection to do based on the findings and what that can mean for, public health interventions or for the analysis. But I think it will be beneficial to have other studies conducting similar kinds of, multiple or accumulation of exposures on asthma outcomes, maybe in another state or another location. And also understanding different factors that might be tied. Maybe we can also stratify by cities and have more focused understanding and whether other factors like health insurance might play a role. And further analysis could also focus on understanding the threshold temperature that might be associated with asthma risk, so that we can provide a concrete number on the risk that might be associated with asthma risk. For neighborhood interventions, I think understanding better whether having availability of cooling centers and green space does have a positive impact in health outcomes, and whether other expansion of cooling centers could have other impacts is another area that could be explored. And there are areas that we can approach, like churches or schools that are not considered cooling centers, and that could be reach out to for expansion of availability of cooling system. And also, I think it's important always to consider the communities that are directly impacted. And while it's always important to understand this, risk that are associated with extreme heat, sometimes, as I mentioned, these are not a priority need for communities. Here in specifically New York State, there are people who having to move out from their houses because of the highway demolition. So talking to them about extreme heat is not a priority and not about their interests. So aligning what their priorities are, what their needs are, and then also how do we wisely leverage that to address both their needs as well as climate issues. I think it's important to account that into for future directions. And so I think that's all for the results, and I just wanted to thank you for listening and acknowledge the people who have been involved in this analysis across different institutions, and also acknowledge the funding support from NYU that comes from NIH and EHS that supported the work conducted in this study. And so thank you again for your attention, and I welcome any feedback, suggestions, or questions that you may have. Thank you.
Thank you so much, Dr. Lee. Yeah, feel free to put your questions in the chat or the Q&A box. And then if you'd also like, I can take you off mute, just raise your hand. And we can allow you to use your mic.
Great presentation and a lot of amazing work connecting different data sources for this analysis. So one of my questions for you is how do you think your access to these kinds of data, like if you could kind of think forward and like, what do you need in order to continue to look at this over time? And I know there's been a lot of changes in particularly around environmental health issues. Do you see that there's a way that you should be thinking about this work as you're moving forward to ensure that we're able to continue to analyze and understand the impacts of environmental factors like heat and redlining on population health?
Yeah, no, thank you for the question. And I think ultimately we need to provide this access available, make them available to the communities. I think so. As I mentioned, this is not a priority for those communities that are going significant issues, but I think it's important to provide data real time. And also, I know this, like the hospital data is limited for the public, but provide, kind of real time trends of how these are extreme heat are increasing, and then also health outcomes might be increasing, and kind of, involve communities in this dialogue of, how can we, the trends that are continue to increase. So making this, simple, maybe a data, a website where we are seeing these trends and how that's affecting them geographically, and that how, if they are connecting them more to their, if they're having, asthma issues, they may pay attention and link those dots to their own lives. So I think making them available to the extent possible, real time, I think that may be helpful. And then, yeah.
And I did have one other question. I think that one of the things we're seeing right now is that there's this sense of, well, what about us kind of perspective, and like, okay, rural community. Is there an issue, similar issue between the relationship of heat and social drivers like persistent poverty that may also be, so it's a common mechanism, social and environmental drivers for a health outcome. Have you seen any research that's looking at rural and urban? I know you wouldn't be able to include redlining because that is an urban phenomenon, but a lot of the other measures you can see, and a corollary indicator of systemic or structural disinvestment would be like a measure of persistent poverty in a community. And I know there is increasing interest in including measures of persistent poverty. So I was curious if you know of work that is starting to include rural communities as well around these environmental exposure outcomes.
Yeah, and I think that's a good point. And I think I guess the reason for this analysis we focus on urban areas is the impact of urban heat island effects, which are more common in urban areas, and the impact of redlining that are also primarily in urban areas. But I also acknowledge that there are issues in rural areas that should be looking at. There are other issues that should taken into consideration that may be different in urban areas. And the health impacts might be different. Forgive me, I haven't come across such robust analysis comparing urban versus rural areas, because these are drastically different topics. But I think it might be worth looking into it, even within the data set side I have to comparing those rural versus urban areas.
We do have a question in the chat from Tim. He says, thanks for this interesting talk and congrats. It looks like you adjusted for a large number of covariates. Reviewers will almost always ask for this if you have the power to handle it. And so I can see why this is done. Have you considered doing sensitivity analysis with a restricted set of covariates? DAGs might be helpful in this process, but there are a lot of variables. It could get complex.
Yeah, thank you for the question. And I think regarding the number of covers that I included, I know these are a lot, but these are actually the recommendation from the reviewers to include those covariates like cooling center, green space, and all of those. And I mean, there wasn't much difference between like the unadjusted versus adjusted model. And then the sensitivity analysis was done based on like different grading measures, like A plus B versus degraded. Different ways that can be done with the different grading analysis for sensitivity analysis. And there wasn't much differences, but this is, I guess this was the suggestion from the reviewers, to adjust those impact factors.
Shannon asked, have you looked at all at gentrification and the effects of displacement?
Yeah, so I know there are some metrics that people are using. Some different researchers are using gentrification, using a different metric of social, just population migration. For this analysis, we the closest that we were able to control that it was population density. Because the gentrification isn't a factor that we were specifically looking at, but we do take into account the population density to account for potential changes in demographic across neighborhoods.
Dr. Lee, I wanted to ask, it looked like you had a photo of maybe like a community meeting about the highway demolition. Have you connected with like neighborhood groups or organizations in Syracuse that are organizing around environmental health issues?
Yeah, so I don't know if I'm sharing the slides correctly here, but yeah, this is I mean, I think I've been here for 2 years and I think I need to get more involved, but we have been participating. There are ongoing kind of events where community members are being informed. These are ongoing events real time where they are confused and they are being informed how to move out from the communities. And so I think I've been participating in these events. We haven't, I guess for research sake, I haven't been as involved with the communities, and I think this is not a good time to be conducting, analysis, research with them. But I think we have been. I think the faculty here at ES have been involved or connected to communities from in different ways.
have any other questions, you can put them in the chat. I don't see any right now. We're at time. Thank you so much, Dr. Lee, for your presentation. We'll make sure to send the slides to everyone, and then we'll put the recording up on our YouTube channel by the end of the week, and share it out with everybody in case people who are registered couldn't attend, or if you want to share it with everybody. Yeah, Darcy, any final thoughts or comments?
Thank you. It's good to see everybody, and hopefully we'll see you for our final seminar in November. Thank you.
Thank you. Have a good day.